President Joe Biden tested positive for COVID-19 and did not wear a mask in public on a couple of occasions after the White House announced his positive diagnosis. The White House stated that Biden had mild symptoms, while the president's doctor indicated that Biden would be isolating in accordance with CDC guidelines for individuals with symptoms, referring to the Centers for Disease Control and Prevention. But what do the CDC guidelines indicate? What does the White House say? After Wednesday's announcement, Biden was seen without a mask as he got out of his motorcade upon arriving at Las Vegas Airport, where he attended several events and boarded Air Force One. He also did not wear a mask, which doctors say can help curb the spread of the disease, when he disembarked hours later at Dover Air Force Base in Delaware. Biden was surrounded by Secret Service agents and staff during both parts of the trip. White House Press Secretary Karine Jean-Pierre said in Wednesday's announcement that Biden, 81, had mild symptoms and would proceed with plans to travel to his residence in Rehoboth Beach, where he would isolate. Biden's physician, Dr. Kevin O'Connor, said in a separate statement that Biden had a runny nose, dry cough, and a sense of general malaise. He mentioned that Biden was being treated with the medication Paxlovid and would be isolating in accordance with CDC guidelines for individuals with symptoms. What do the CDC guidelines indicate? The CDC encourages people recovering from COVID-19 or any other respiratory illness to wear masks as part of a strategy to reduce disease transmission, but mask wearing is not mandatory. The agency recommends that people stay home and away from others if they feel sick. They note that individuals can resume normal activities when symptoms begin to improve and they no longer have a fever. The CDC states that masks are an additional strategy to prevent the spread of the disease, but generally leaves it up to individuals to decide whether to wear them. The agency asserts that masks are especially useful when someone is sick and suggests that they be used as a precaution during recovery. What does the White House say? The White House has not responded to an email request for comments on why Biden did not wear a mask. How is Biden? O'Connor said Thursday that Biden was still experiencing respiratory symptoms from COVID-19. The president did not have a fever and his vital signs remain normal. Quentin Fulks, the principal deputy director of Biden's re-election campaign, said Thursday that Biden felt fine and was making calls and working. Fulks spoke at a press conference at the Republican National Convention in Milwaukee. White House National Security spokesman John Kirby told reporters during a separate Zoom briefing that Biden was being kept up to date as appropriate by his leadership team, and that certainly includes on the national security front.